Professor OSAHON ENABULELE, President of the World Medical Association. So, please.
Right. Okay. Prof, please, you should stop that time because it's counting for me already. All right, good morning. Thank you very much. I want to join to thank all those who were able to make it today. I'm told that today is a free day, and so I want to also appreciate your presence here this morning. So I bring you morning greetings. I don't know why I still need to go ahead to present because Professor Abata has indeed done all the presentations. And I don't know whether there is any need for me to still go ahead, because I can only just add to what you have said. But honestly speaking, I had a good time last night, and I returned back to my hotel room around 1:30 a.m., and it was a good time for me. And I now, from there, look forward to this presentation. I had to put down my thoughts, when I came back from that very exciting visit. And so please, in addition to what he has presented, I intend to look at the role of the medical profession in innovation adoption and risk management. And I'd like to do this using this outline, setting the scene. I'm happy he's done a lot of that. I'll look again at some basic definitions, the benefits and potential risks of healthcare innovations, and I'm happy again he has talked about so many of them. What are the barriers to innovation adoption? And of course, the role of the medical profession, and I hope I have time to conclude. I don't know why that time is still running. This is 5:29. How much time do I have? 8 minutes. Okay, fine, thank you. Now, to set the scene, medical innovation, we all know, is not new. It's been there. When you look at the history of medicine and medical evolution, from the era of generalism to the era of specialism, you find out that as a result of societal needs, the need from, to advance the medical profession, a lot of medical devices came up, especially as we move towards specialism in anesthesia, in surgery, and so many other areas. But importantly, it was in the last decade that we saw a lot of movements in terms of healthcare innovations coming into the healthcare industry. And of course, we've had also innovations in other sectors of the global economy. And so innovations remain very germane, just as medical practice we know is also very germane in terms of clinical care. And so it's how to incorporate or integrate healthcare innovations into medical practice that I think this whole session was deemed necessary for us to engage the issues. Now, therefore, I consider this as a very dazzling opportunity to help us look at how to balance healthcare innovations with our clinical practice, particularly looking at the benefits and, of course, the risk. Now, what is health innovation? Of course, a lot has been said in the last 2 days, and I do not intend to dwell on this again, but just to say that even the World Health Organization has been able to put together a definition in terms of what health innovation is. So it's not enough to just innovate. We're looking at how it makes impact on the healthcare system. And so it says a new or improved solution with a with the ability to transform healthcare systems in terms of accelerating positive health impact. And of course, we all know what the medical profession is. I'm sure a lot of us here are members of the medical profession. Now, there are qualities of every profession, and of course, most of them will have some of these ingredients in terms of having a code of professional conduct, of course, established regulatory body and regulatory licensure laws, and established training schools, as well as an association. Of course, we have the Israeli Medical Association that has brought all of us here together. So these are some ingredients that, of course, defines every profession, be it medical, legal, teaching profession in various parts of the world. Now, I haven't stated that, and because of time, I would like to look at what we can consider as some benefits of healthcare innovations. Now, the first is that we all know that it has helped us to bring on board improved ways of delivery of healthcare services in terms of improved diagnostic methods, of course, improved technology for treatment, in terms of therapeutics. In terms of therapeutics, improved diagnostic methods, therapeutics, and vaccines. We just saw a fundamental experience just now. Fundamental method of delivery of care to those with some conditions, Parkinson's and all of that, essential tremors. And that, of course, could not have been done except people got together to think about better ways of delivering this treatment modality. So it helps to bring about new methods, improved methods of therapeutics treatment and vaccines. Of course, the last we saw in the case of COVID, we had new COVID vaccines, which of course helped to save humanity largely. And of course, it's also improved medical devices and health infrastructure. We also, in a way, through innovations, engender job satisfaction amongst the providers, because again, unlike doing the job of several persons, you have some technologies helping you to, of course, undertake those tasks. And that, of course, can reduce the kind of energies you exert in the course of administering care to your clients. And that, in a way, can also help to reduce your burnout. We also have better patient experience. In fact, that is the whole kernel of health technological innovations. How do we make the patient experience better in the course of delivering care to them? So it also is supposed to impact on quality outcomes. In fact, any technology that fails the test of quality, safety, and efficiency, of course, cannot be said to be a healthcare innovation or technological innovation. So it's supposed to also boost confidence in the healthcare system. When patients have when they have better experiences in course of undertaking the journey through the healthcare industry, they are more likely to have better confidence in their providers and, of course, the healthcare system. Now, are there risks? And I said there are. In fact, a cornucopia and concatenation of risk, and I'm happy that Professor Abata, again, at least based on his own empirical evidence, has been able to outline a lot of them. But I want to add a few more. Of course, one of the risks is the potential for harm, to patients. And of course, that, will drive resistance in terms of adoption of these healthcare technologies. Compromise of privacy and confidentiality, compromise of informed consent, potential conflicts of interest. That also is a major issue. And unfair access to some of these technologies, which can drive inequities and, of course, inequitable access to healthcare resources. And in the light of universal health coverage, that is a major challenge. Now, are there barriers to healthcare innovation adoption? There are several. And the first is the fear of potential harm, which can make patients not even adopt these technologies. Resistance by end users, the physicians themselves, the healthcare providers. And this is usually on account of the fact that sometimes they are not involved in the whole process of procurement, in the whole process of innovation. And so there's ignorance, there is some level of, poor, change process. The change process is not well adapted to them. And you also have institutional political commitments, limited finances, it's talked about that, monitoring evaluation and intellectual property issues, patent rights. Now, for health technological innovations to make the desired impact, the medical profession must certainly play a key role. And what are those roles? First is the issue of leadership. Of course, Leah talked a lot about that. We must own it. The profession must have some level of responsibility. And leadership, we know, is about, getting, leading a team, organization, or a group of people along the line of an envisioned feature and getting all votaries to key into that vision. And so if we see this as germane, then we must seize leadership and, of course, be able to drive the direction in healthcare technological innovations. Ethical requirements. The WMA, for instance, is a repository of most of those ethical regulatory policy documents. And so we need to be able to safeguard the regulatory standards. The WMA, for instance, as the anchor of the medical profession, we'll have to drive collaboration, first among physicians, between the physicians or the profession and the healthcare industry, and even other science-based experts in terms of the sciences, and ensure there's end-user integration. Of course, time is not on my side. Time is running now. There's issue of medical education curriculum. How do we adapt it to our training curriculum? How do we advocate for equitable access? And of course, promote research, data, and information sharing. Advocacy for more investments in terms of financing of technologies. And of course, in our day-to-day task, patient counseling and education. And we can institute Excellence Award to promote innovations amongst our scientists. In conclusion, the place of health technological innovations in healthcare delivery cannot be overemphasized. There is, however, need to ensure the benefits outweigh the risk at all times. And to ensure this, the medical profession must show leadership and play a key strategic role in health technological innovations. I thank you very much, and I hope I have not bored you. Thank you. Thank you for presenting.